Hello everyone, welcome to my class today. Today we'll see the new unit in nursing foundation subject, that is meeting needs of perioperative patients. So today we'll see just introduction about the unit. In the later classes we'll see the different phases in the perioperative nursing. In history of perioperative nursing, so in the year 1875 the first lecture was given to nurses on perioperative nursing at Johns Hopkins University, and Florence Nightingale, who is called the forerunner of nurses, so she is called the first perioperative nurse specialty, and she is one of the distinguished practitioners, so we have heard more about her. And in 1956 an association of operating room nurses, they found the importance of providing knowledge and also improving the methods of nursing care of perioperative nurses, that is the methods how they give care to the clients during surgery. And this organization, they formulated standards of nursing practice, and also they told about the roles, responsibilities of the perioperative nurse. Okay, and coming to the introduction, so this perioperative care will start from the time when the patient is hospitalized and when the decision is made that the person has to go for surgery. Okay, so the nurse in the perioperative unit, they will assess the patient then for the need for surgery, and they will collaborate with clients and the family members in order to reinforce the person about the surgery, and also allow the time for the patient and family members to learn about the surgical procedures, the post-operative care, etc., so that all the teaching will be given in the perioperative phase. Okay, and this perioperative nursing, they will prepare the client for surgical procedure, and they also will collaborate with other professionals like anesthetists, work as a team in order to promote the client's well-being. And the roles, responsibilities, the assessment, client family teaching, intervention to promote client achievement, and also expected outcomes, that is evaluating the client for recovery. So these all the functions perioperative nurse do, and the perioperative nurse must be a registered nurse because they need a wide broad knowledge about the surgical care, etc., so that the complications will be prevented. And they also has to know how to apply the nursing process, making diagnosis and also delivering, that is implementing the nursing care for patients who are undergoing any surgery or invasive procedure. Invasive is whenever we do some procedure by injecting or inserting something inside the body, then it is called as invasive procedure. And these nurses should have good skills and knowledge to assess, diagnose, plan, and intervene is do the interventions and evaluate the outcome. Okay, so these are about introduction, and next is definition. So perioperative nursing is defined as a practice of registered nurse. So this practice is done by registered nurse who are specialized to perform nursing activities in the pre-operative. Pre is before operation, intraoperative is during the operation, and post-operative phase, that is after the operation. So their work will start from the pre-operative period till the person is in the recovery unit. Okay, so during of the surgical experience, the person who are working in this perioperative nursing unit, so initially they may not have a expert level of knowledge, so at beginning level they keep learning and they can progress to expertise, and also they can move forward to the advanced level of practice. Okay, coming to the concepts of perioperative nursing. So first, the nursing care is not like previously in olden days the care was only open surgery where there is more chance of infection and also complications. But nowadays there is high tech quality care is given, so that means so many technological improvement is there. There are new machines, monitors have come, and the surgery is being shifted to most innovations like virtual endoscopy, robotic surgeries, and computerized navigation surgeries, transplanting tissues, and also biological materials are used like to worn out the tissue. Okay, like in case of valve replacement, and also in case of skin grafting. So there is also biological materials to replace the tissue. So through radiofrequency identification we can also perform like heart surgeries and any surgeries in the blood vessels. And transoral approaches is like endoscopic and electronic health records. Okay, so these are the most high-tech quality instruments are there. So nurses has to be equipped with the knowledge to handle these high-tech procedures. Okay, so we have to provide high-tech quality care. And next is comprehensive care. Though nurses in the perioperative unit will meet the patient for a specific time, that is in the preoperative, intraoperative or the postoperative phase, but during this phase they have to provide comprehensive care. That means they have to meet the physiological, psychological, socio-cultural, spiritual, all the needs of the surgical patients. Okay, so because patients may have anxiety, fear during surgery, and they may also think about God, so all the spiritual needs has to be met, and they should also educate on all this aspect the patient, so that they will have a good improvement or outcome will be good. So that is, we have to provide comprehensive care. Next, perioperative nurses, they can work in different settings, like in patient home also. So if patient has undergone any invasive procedure and they are shifted to home, then she can see the patient's prognosis at home. And also in clinic, like some small procedures like IND, incision, DNA, so these procedures can be done in the clinic. And also physician office and patient care unit, pre-surgical care unit, holding area, that is holding area where the patient is kept for surgery, and also ambulatory surgical care centers. Okay, so in all these areas perioperative nurses can work. So after any invasive procedure, when the patient is shifted to post anesthetic care unit, that is the recovery room, there also their work is extended. That means their care is extended, so that they can see the patient's outcome, the outcome of the patient, that is whether there is improvement in the surgery, that you can identify in all these areas. Okay, and next is nurses has to provide care with multidisciplinary coordination. Okay, that means the perioperative nurses must also coordinate with other nurses in the ward, that is, or in the ICU, wherever they receive the patient. So from those areas also they have to coordinate with other specialty nurses and other healthcare professionals like anesthetists, doctors, laboratory technicians, referral centers. So all those areas they have to coordinate, and also they have to supervise the work of the other personnel, so that they can provide safe and efficient practice for the patient. And next, they must also act as a patient advocacy. Okay, that means when patient is not able to take decision, or when he is in a vulnerable situation, the nurses must use their skills, all the scientific knowledge, and their intuitive ability. Intuitive means some inner desire or inner feelings they have to have towards the patient's disease, and they have to immediately take some action, or they must be flexible in taking action that can be safe for the client. Okay, so that the patient will be safe in that environment. So they act as a patient advocacy. And also, so perioperative nursing care needs more of knowledge based and education. Okay, during surgical procedure they must know all the anatomy of the body parts. Every knowledge has to be there, so that they can identify all the consequences, the risk factors, or they can prevent the injury, the psychosocial implications of surgery. So all these things they can identify only if they have a broad knowledge base, and rapidly they can take action. They can use their knowledge in doing appropriate nursing interventions. And next is delivering care using scientific model. Okay, scientific means they must have reasons. So every time whenever the perioperative nurses they provide care, they have to use rationale. So when we do some intervention, we should see why I am doing that, how to implement, whether it is safety for the patient. So everything we have to identify, and then do only if it is effective for the patient and it has good outcome. Okay, so this knowledge will empower the perioperative nurse to prepare for the next surgical procedure, and also understand the next subsequent implications of the patient and for the surgical team. So they have to do every procedure with the scientific rationale, and they must give care using critical thinking skill. And also there should be some professional standards and rules, ethics, which has to guide the nurses in order to provide good outcome for the patient. Okay, and continuously we have to keep learning and we improve so that we can have good clinical judgment. And providing care within the framework of nursing process. We must be able to assess, collect, organize and prioritize the patient's data and also establish nursing diagnosis and plan the goals, plan and implement the care, and also you have to evaluate the care. Okay, assessment can take place in the holding area, that is where the patient is kept before the surgery, and interventions will be done in the operating room, and evaluation about the outcome of the surgical procedures can be identified in the recovery room or once the patient is getting discharged from the operating room. And whenever perioperative nurses give care, they must provide client-centered care. Okay, so client should be the focus of the all the care given. So whenever they have to do procedure, they have to focus the client. So based on the needs of the clients during the interview, what needs the clients is there, so that has to be followed till the discharge. Okay, so we must have a subjective connection. Subjective is we have to see the complaints of the patient and we have to deliver the care objectively, but by observing the patient's prognosis, and we have to understand all the medications what we are giving for the patient and their effects, and also while surgical procedure what positioning that should follow. If we do some improper positioning, what will be the complications? So everything the surgical nurse has to understand and provide care so that it will be based on client satisfaction, and also at the same time we have to prevent the complications for the patient. So this is about just an introduction. I hope you understood my class. Thank you for listening. Please like, share, subscribe and also click the notification button for regular updates.